Hi, good morning. This is Jason Thompson of Emergency Products and Research, and with me today is my daughter Allison, who is 10. She is going to be helping us to model and demonstrate the Mustang traction splint. The application we're going to do for pediatrics today is we're going to show lower extremity and upper extremity management. So we're going to simulate that she has a displaced femur and also a displaced humeral fracture. We'll do our best to simulate this. Obviously, we're not going to apply traction. We will do neurovascular checks to establish baseline and check throughout. If you have any questions specifically about that stuff, please feel free to ask me. You can contact me at jasont@epandr.com. All right, so let's see what we got here. So, all right, so here's what we're going to do. So Allison has a fracture of her, let's say her left femur, right? And we're also going to have a fracture of her right humerus. So what we're going to do here is let's go ahead and do her femur first. So again, so what we're going to do is we're going to obviously do a neurovascular check. Make sure she's got good pulse. She's got good sensation. Can you feel that? All right, can you move your toes? Good. So we've got baseline. And what we're going to do is we have this part of the Mustang traction splint. This is our anchor harness. So I'm going to apply the anchor harness over her foot. Let me go feed that up underneath here. Okay. I'm going to tighten this down to some extent just to take some of the play out of that. We're going to take the traction harness. We'll take the traction harness and we're going to apply that to her leg. And what we'll do is this part here, this is where our the actual anchor is at for the traction. So we're going to take this and this is going to go towards her head. So what we're going to do is take this over here. I'm going to feed this up underneath her knee. Okay. Right. I'm going to feed that up. Okay. So go ahead and feed that into the cam. And I've mentioned this in other videos. This version still has the cam lock in place, which has been replaced by D-rings for greater stability and security. And so we'll take our traction pole, assemble this here. Now what we're going to do is we're going to take this and we're going to slide this up through. There's a little loop here, I don't know if you can see it. Feed it up through that loop. We're going to feed it up into the pouch, the top here. Okay, that's going to go all the way out. And we're going to come down here and we're going to take a look at her foot. And we're going to reduce this. I'll probably reduce this by one section. Drop this down. I'm going to go ahead and feed this into the pouch. And at this point we can go ahead and we'll tighten this down. Now it's not a constricting band, so you just want to have it on there tight enough to where it gets good grip onto the ankle. That's all you need. Okay, so at this point, let's come back up here. So we have, this is already set up for traction. So what we're going to do is just go ahead and take the play out of this a little bit. So let's tighten this down here. Okay. And now what we're going to do is we're going to set this up and just take this, tighten this up. Feel snug? Okay. All right. Now we're going to take this quick cravat and feed this up underneath her leg. We're going to tie this off. And again, I always try and make sure we tie this off to the side so we don't do pressure points over the skin. We'll go ahead and do another one up underneath her lower leg. And these quick revets, when they come fresh out of the package, they're already laid out. These are quick revets that I've been using now for months and months and months of training, just to show the strength and dexterity of the product. So they tend to get a little unironed, if you will. I'm gonna put this up underneath her leg here, and this one we're gonna walk up here. It's okay, we're good. Okay, so just a quick review. We know these quick revets are essentially just to keep the pull against the leg, to prevent it from bowing out when you apply traction. And you want to make sure that they're nice and snug, not overly tight. Again, you just want to make sure that it just holds everything nice and snug against the leg. Okay, so now that we've gotten the quick revets in place, what we'll do is we're going to take we'll do another neurovascular check for foot. Feel me touching? Mm-hmm. Okay, can you wiggle your toes? Yeah. Good pulses. Okay. All right, at this point, we're going to go ahead, and now we would just apply traction. At this point, I'm not going to do it because I don't want to hurt her leg unnecessarily. But we're going to apply enough traction so to the point where we're reducing the displaced femur fracture. And we can obviously watch and check for deformity. If we have obvious deformity, have we reduced that deformity? And at that point, do we have an improvement in her pain scale? There's numerous ways of actually looking at this to determine whether or not we have effective traction. The biggest thing is obviously to reduce that fracture as quickly as possible, is to reduce the amount of pain, and also for neurovascular compromise. So with that, we also want to go ahead and try to splint as well. So we know that during the traumatic event that caused the femur fracture in the first place, we know that a lot of the vascular structures are damaged. So what we're going to do is go ahead and use vacuum splinting, and that will go ahead and that will compress the anatomy as well, to also further improve the amount of control or direct pressure over those structures to prevent additional bleeding, and also to obviously decrease swelling. So these are just InstaSplint vacuum splints that we have from Humerus Products and Research. Get that on there pretty quick. Okay, and then we'll just take our pump, vacuum pump, and just plug that in here. Okay, so we've done PMS. Good feeling? Okay, wiggle your toes. All right, and then I'm just going to do about 8 draws. So at this point, I've got good pressure over the injury. I can also use this opportunity I still can manage my assessments, so I can reassess the injury. I can monitor for additional swelling. I can put ice packs in here. I can do all kinds of things. So a very versatile tool. Together with the Mustang traction splint, you have nice immobilization, ready packaging, and she's ready for transport. So we'll continue doing our assessments, and that will be it. Now, as far as her humeral fracture, we're looking at this as far as her having a fracture of her right arm. So I'm going to take this off. So, all right, Allie, let me see your arm here a second. All right, so now we're going to assume that she's got a fracture, a mid-shaft fracture up here. So what we're going to do is do the same thing. We're going to take our anchor harness, and the anchor harness will go up on the arm just like this. This one has the D-rings. You should notice the difference. And this is how they will be coming packaged. So we're taking the anchor harness is going to go up above the injury, and the traction harness is going to go below, so distal the injury. So let me see here, I get this backwards. Here we go. And we're going to take this nice and relatively snug around the wrist and draw that out. This still staying a little loose because we're going to need some play in there. Grab my pull sections. I'm going to assemble my pull. So I'm going to go ahead and line this out along her arm. And at this point I'm going to take this down through the loop. I'm going to feed this into the pouch. Push that back out. Now I'm going to reduce this down by 1. I'm going to move this back in here. I'm going to reduce this down by 1 section. So let's take this down here. How much is that going to leave us? Obviously, it's nice about the half increments on the peds for the pediatrics just for this purpose. So we're going to reduce this down. We're going to take this up into the pouch. We're going to drop that in there. And at this point, you can see I got good control. So what I'm going to do is I'm going to snug this down here. Apologize if I pinch you. And then we'll snug this down. All right. So now we've got that on place. I'm going to take some quick cravats. I'm going to go around the elbow in this case. Let's go around the forearm. And again, we want to continuously check our neurovascular. I didn't do that at the beginning, and I apologize, but I'll do baseline here before I pull traction. And let's just go up around the arm here. Okay, and again, all we're doing is we're trying to keep the splint, the pull in place, so when we pull traction that we're not, it's not going to bow away. So at this point, I'm going to check. Can you wiggle your fingers? Good wiggle. You feel me touching? Okay. All right, and then I'll go ahead and just do a radial pulse. Good, nice and strong. Okay, and at this point, I would pull traction. But again, I'm not going to do complete traction on her because I don't want to injure her arm. But you can see simply just how that works. And again, I could do the same thing. I could take a vacuum splint, and package that up, same as I did with the leg, to help give me more direct pressure up here to control swelling, reduce bleeding, and improve her comfort. So anyway, this is Jason Thompson, University Products and Research, Allison Thompson, and if you have any questions, let us know. Mercy Products and Research, Jason T at epnr.com. And thank you very much for watching. Let us know if you have any questions. Thank you. Bye.